Hello everyone, my name is Jorge Acosta and I'm going to talk about the therapeutic clearance of amyloid by antibodies to serum amyloid P component. Presentation, this is my information about my social networks. So definitions, amyloidosis is a disease where misfolded proteins aggregate and form large deposits in tissues, leading to organ dysfunctions. SPA is originally isolated as a serum derivative proteins found in all types of amyloid deposits. The first video is about the definition of amyloidosis.
Amyloidosis is the term used to describe a group of diseases in which deposits of an abnormal protein called amyloid form in tissues and organs throughout the body. Proteins are important molecules involved in almost every structure and function within our cells. They are made up of chains of smaller units called amino acids, which fold themselves into three-dimensional structures. Folding allows the protein to work properly and interact with other molecules. In amyloidosis, proteins are made in the normal way, but when they are released from the cell, they open up again. These abnormally folded proteins collect together in long chains or fibrils. The deposits they form are called amyloid. Amyloid fibrils are difficult to break down, and as they accumulate, they start to cause damage. Eventually, the build-up of amyloid fibrils stops the affected tissue from working properly. AL amyloidosis is caused by a bone marrow disorder. The bone marrow produces blood cells, including plasma cells, a type of white blood cell that forms part of the immune system. Plasma cells make antibodies to help fight infection. Each antibody is made up of 4 protein chains, 2 heavy chains and 2 light chains, which attach to each other to form the complete antibody. In AL amyloidosis, the abnormal protein that builds up and causes problems is the antibody light chain, hence the name AL amyloidosis. Instead of attaching to heavy chains, the abnormal light chains open up and bind to other abnormal light chains to form amyloid fibrils. These gradually build up over time. Amyloid light chain fibrils can occur almost anywhere in the body, but the organs most commonly affected include the kidneys, the heart, liver, spleen, nerves, and the digestive system. Treatment for AL amyloidosis involves chemotherapy, steroids, high-dose therapy, and stem cell transplant, and other drugs. Treatment is aimed at reducing the plasma cells to stop further amyloid light chains being made that would otherwise build up in tissues and organs. It also gives the body a chance to break down existing deposits naturally. However, on its own, this process can take many months or years. New treatments which break down the amyloid deposits more quickly are currently being tested in AL amyloidosis. The hope is that they can reduce symptoms and restore function quickly, and in doing so, improve quality of life for patients.
The next video is an overview of the amyloidosis.
Amyloidosis is a disease of protein misfolding, where there are abnormal proteins in the bloodstream. These proteins, because they're abnormal and unstable, are very sticky by nature. And therefore, as the blood flows to the organs or the organ systems, these proteins will deposit into the organ systems and therefore accumulate in these organ systems, causing organ damage. AL stands for amyloid light chain. Light chain protein is a part of the immunoglobulin antibody protein. This light chain fragment from the antibody can break off, or the abnormal bone marrow cells can make excess of this light chain fragment, which can then circulate and deposit into organs. AL amyloidosis is always caused by a group of cells going abnormal in the bone marrow. Having abnormal cells in the bone marrow is very, very common. Over the age of 70, maybe 1 in 10 people, or maybe even 2 in 10 people will have an abnormal bone marrow cell. Usually these are benign. It's a condition called monoclonal gammopathy of uncertain significance, or MGUS. In a very small fraction of these MGUS patients, the protein produced by the MGUS cells has got this peculiar sticky property and cause amyloidosis.
The next video is about the serum amyloid A.
It increases in response to inflammation. In circulation, it is associated with high density. Serum amyloid A is a major acute phase protein with a very short half-life, and it is a positive acute phase protein, which means it increases in response to inflammation. In circulation, it is associated with high density lipoproteins, and it is also classified under alpha-1 globulins. It's a major APP in most of the domestic species except pigs. The concentration increases 1000 times within few hours in response to inflammation, and because of its short half-life, it rapidly decreases once the inflammatory cause is removed or the inflammation subsides. This makes it a more reliable marker for acute inflammatory diseases. Coming to the structure, serum amyloid A is between 11.4 to 12.5 kilodaltons, and there has been several isoforms of serum amyloid A that is reported in each species, but they differ in several amino acid residues. For example, canine and feline consist of 111 amino acid residues, while equine species consist of 110 amino acid residues. Serum amyloid A is produced majorly in the liver in response to inflammatory cytokines such as interleukin 6 and interleukin 1. Extrahepatic synthesis is also documented in animals, and the organs involved are lungs, mammary gland, uterus. When the cells are injured, the macrophages are activated and they secrete interleukin 1, interleukin 6 and tumor necrosis factor alpha. The interleukin 1 and 6 acts on both bone marrow and liver. In bone marrow, they will stimulate hematopoietic progenitor cells and thus releasing more inflammatory cells into the circulation. And in liver, they stimulate the liver to produce acute phase proteins including serum amyloid A. This helps to promote chemotaxis of neutrophils and mast cells. It also functions as a inflammatory and immunomodulatory protein and also induces secretion of inflammatory cytokines. It is also involved in lipid metabolism. Serum amyloid A signals through multiple receptors. The most common receptors include CD36 and toll-like receptors 2 and 4. Extrahepatic synthesis of serum amyloid A also occurs in synovial fibroblast, and chronic elevation contributes to the pathogenesis of diseases such as rheumatoid arthritis. Is also associated with amyloidosis. Coming to the laboratory interpretation, the concentration is increased in both local and systemic inflammation. In cats, the high levels of serum amyloid A has been recorded in diabetes mellitus, hyperparathyroidism, feline infectious peritonitis and pancreatitis. And in horses, It is used to detect inflammation related to joints such as arthritis. The highest concentration of serum amyloid A is noticed in synovial fluids and peritoneal effusion secondary to colic in horses. And serum amyloid A is a good test to diagnose and rule out subclinical infections. Coming to the sample collection, blood can be collected in both serum separation tubes and heparinized vials. Fluids such as synovial fluid and peritoneal effusions can also be collected to estimate the serum amyloid A concentrations. That's it for today's video. I hope this video was informative. Thank you so much for watching.
Application in medicine. Current treatment consists of support or replacement of failing organs and measures to reduce the abundance of the amyloid fibril precursor protein A. Sufficient reduction of precursor supply arrests the accumulation of amyloid and can reduce morbidity and mortality. This is the video about what does this mean. This is the definition about the serum amyloid P component.
Serum amyloid P component. Amyloid P component is a small, non-fibrillar glycoprotein found in normal serum and in all amyloid deposits. It has a pentagonal, pentaxin, structure. It is an acute phase protein, modulates immunologic responses, inhibits elastase, and has been suggested as an indicator of liver disease.
The other video is about the future AL amyloidosis treatment.
For many years, AL amyloidosis was an orphan disease. We were trying to get drugs through myeloma treatments, but now there are effective treatments. We are able to control the disease, and a lot of new drugs are being tested in amyloidosis. The treatment in amyloidosis is moving forward in two different ways. One is we've got new types of drugs which will kill the abnormal cells in the bone marrow, similar to the standard treatments, but they're improvement on the standard drugs. So we've got two new proteasome inhibitors, the Velcade-like drugs, one of them called as carfilzomib and another called as ixazomib, which are both highly effective proteasome inhibitors. Carfilzomib is given intravenously, whereas ixazomib has got the advantage of being taken as a tablet every week. Both of these drugs are being studied in amyloidosis. We are running clinical trials with both these drugs to assess their effectiveness in amyloidosis. There is a new monoclonal antibody which is very effective in killing plasma cells called daratumumab. This is a drug which has been extensively studied and appears to show great promise in myeloma treatment, and a clinical trial for this is being planned for amyloidosis, hopefully starting quite soon. And we think this will be a relatively non-toxic but highly effective treatment in patients with amyloidosis, particularly those with heart involvement. The key issue in amyloidosis is not just killing the plasma cells and reducing the light chains, but to improve the organ function, to actually clear the amyloid protein deposits. For many years, we had no means of actually doing this. We know that in the body, there are immune cells or scavenger cells which will eat away the amyloid deposits. There are new immunotherapies which can accelerate the clearance of amyloid deposits from the body. And there are 2 or 3 such antibody treatments which are being studied in amyloidosis. One is an antibody developed by a company called Prothena, called NEO-001. There are 2 phase 3, which means very advanced phase clinical trials going on. One for patients with amyloid in the heart in the newly diagnosed setting, and one for amyloidosis in patients who've already got heart dysfunction. And we hope that this antibody will go to licensing provided these trials show good results. There is another approach that we've developed within the Amyloidosis Center in the UK, targeting a small protein called SAP, the same protein that is used for SAP scanning for imaging amyloid deposits. This is a protein which is present on all amyloid deposits, and we have a monoclonal antibody which can target these deposits. We have done a small early phase trial with this antibody which has shown very rapid clearance of protein deposits from the internal organs, and hopefully this antibody will move forward into future trials in the future. There are a number of small molecules which are drugs which can be taken which interfere with the way the amyloid protein will misfold or protein deposits form. One of these drugs is an antibiotic called doxycycline. It's an antibiotic that's been around for over 40 or 50 years now. It has been shown for some years that this antibiotic will interfere with the deposition of amyloid fibrils and may protect the heart against the damaging effect of amyloidosis. We have just done a small study which has shown that we can improve the survival for cardiac patients with doxycycline along with chemotherapy, and this is moving forward into some formal prospective clinical trials. Clinical trial.
Pros and cons. Pros: the effectiveness of cytotoxic chemotherapy to suppress the pathogenic clone is often limited by dysfunction on amyloid infiltrate organs, and 20% or more of patients with amyloidosis died within 6 months after diagnosis, before the desired benefits of chemotherapy are realized. And this is the cons. Amyloid regression is very slow and often does not occur at all, in contrast to the usually short clearance of other extracellular debris and efficient tissues remodeling. There are no effective therapies for some hereditary form of systemic amyloidosis. Issues applied in Ecuador: at least 65% of cases of systematic amyloidosis are the monoclonal immunoglobulin light chain type that is caused by B-cell discrepancy. A total of 16 patients 18 to 70 years of age have different types of biopsies proving systemic amyloidosis with screens and quintiles. And the last the conclusions: the patients with a new diagnosis of systemic amyloidosis require swift and safe elimination of amyloid deposits to maintain or restore vital organ functions. So the measures to reduce production of amyloid fibrate precursor protein and thus arrest amyloid accumulation can be effective. And that's it. Thank you for watching this video.